Hi, everybody. I am Coach Michelle Quirk. I am a pediatrician, a run coach, and founder of Mindful Marathon, where I help make running easy and fun for busy professionals. And I am joined today by Dr. Janeeka Benoit. She goes by Dr. J. She is a sports medicine physician. And today we are going to talk about running and running injuries and how to prevent them. Thank you for joining me, Dr. J.
Of course. So happy to be here.
So tell us a little about yourself before we get started.
Okay, so I am a board certified internal medicine physician, specializing in sports medicine. And I got introduced to running in high school. My best friend decided to join the cross country track team. And I was like, well, if she's going to do it, I'm going to try it too, because she's my best friend and I wanted to do what she was doing.
Oh, I love
And
that.
since then, I have been hooked with running. Initially, I was doing it recreationally, just to be fit and because it gave me peace of mind. And then it wasn't until I went to a health seminar, and a sports medicine physician was the one who put on the health seminar, and on his panel he had all these older runners, like in their 60s and 70s and 80s, still running marathons.
I love to hear
And
that. I love to hear that.
I'm like, wait, I have not run a marathon yet. Like, I need to run a marathon. And here we are. There are like people who are twice, three times my age who are running marathons. So then that led me to become more competitive. I started entering races. I ran my first half marathon last year. I was scheduled to run a New York City marathon, but unfortunately that got canceled due to COVID. So hopefully I can run that marathon this year.
Oh, that's exciting. It's going to be great.
Yes.
Oh. Oh, that's awesome. I didn't know that you were a runner in high school. That's great.
Yes.
I came to it a lot later. I was like in my early 30s, but that's okay.
Okay.
That's okay. We're making
No.
up for lost time now.
Oh, that's right.
Well, so you have probably experienced this a lot, whether in your group of friends or with patients, but I know a lot of people have a lot of hangups about running. And one of the things I hear a lot is I'm afraid to get injured. And I totally get that. I'm not sure the exact statistic, but it's something like 50% of runners will get injured every year. So could you tell us like some of the common injuries you see, and maybe some of the things you hear along those lines?
Yes. So the most common injury in runners is called patellofemoral syndrome. And I know that's a fancy term, but a lot of runners get pain on the front side of their knee, so on the front. And usually they don't feel it during running. It's sometimes when they're squatting or with they're sitting down for a prolonged period of time.
Mhm.
That they experience this anterior knee pain. So that is by far the most common injury in runners.
Okay.
Then the most common condition of side knee pain is IT band syndrome, which is also very common.
Yes.
And then there are shin splints. And then sometimes if shin splints are worsened, they can actually lead to stress injuries and stress fractures. So those are common injuries that I see often in runners.
Is the first one you talked about, the patellofemoral pain, is that also called runner's knee, or is that just sort of lumped in with all of these different
Yes,
things?
that's
Oh, okay.
exactly what it is. Runner's
Okay.
knee.
Okay. I know a
Patellofemoral
lot of people
syndrome.
tell me that they have that. Yes.
Yes.
Okay.
Yes.
Okay. And now, I guess along those lines, do you have recommendations, or what are the common mistakes that maybe you see runners making? I have seen a few myself.
Yes. So a lot of, the contributing factors that can lead to patellofemoral syndrome or runner's knee just can be like tight quad muscles or tight hamstrings. There can be various malalignments in a runner and due to muscle deficits. So that's why it's important to go to a sports medicine physician, because the sports medicine physician can, look at your imbalance in your biomechanics and the way that you run or the way that you walk, and do further testing to see which muscles are weakened and therefore need to be strengthened to improve the runner's knee.
Yeah, yeah. Um, I think a lot, a lot of what I see is when really like people start to run, or they get back to it after a long time off, and they tend to go out like a little too far and too fast all at once, and that has often led to things hurting or being sore. And I guess, if someone has an ache or soreness, or what are your soreness rules as far as when somebody should seek, medical attention and see their friendly sports medicine physician and come and see you?
Yes. So, when you're running, things can get sore a lot. So it's always important to take a period of rest if especially the soreness is preventing you from running the way that you normally do.
Mhm.
So at first, it's, take a period of rest. Now, if you take a period of rest, let's say for a week or so, and you go back to running and the soreness still persists, that should be a signal that something is not right. And it's time to go to your friendly sports medicine doctor. And you definitely don't want to run through soreness or any pain, because, like I mentioned before, there could be a stress reaction, just inflammation around the bone. And then if you keep on continually running through that, it can lead to fractures. So you want to be really important to not persist through any soreness or pain, especially after a period of rest, because that tells you that something is going on.
Yeah, I appreciate that so much as a coach, because if anything, if any of my athletes ever tell me something is sore or aching, the answer is always rest, like probably 99% of the time. And we rest for a couple of days or a week and try to run, at an easy, like try an easy run after that period of rest. And if it's still bothering them, that's my advice as well. Then you
That is,
have to seek the professional help.
yes, that is great advice. Listen to your running coach.
I can speak from personal experience as well. I mean, I've been through some injuries as well, and it has gotten easier to know when something is off than when I first started. I didn't quite know, is this just soreness, or should I really be paying attention to it? And after, years of doing this, I think I can tell now, which is really interesting, but I feel like I know how my body is. So that's something like over time, you get a little bit more in tune with yourself and to know when something isn't quite right. So,
Yes,
yeah.
and you mentioned a great point is listen to your body. As you're running, just be mindful marathon. Be mindful of, how you're feeling during running. And is this consistent with how you always feel, or is something off? So
Mhm.
it's definitely important to take in all those clues while you're running.
Yeah. My tip for this is to keep a training journal. This is what my coach taught me to do, and now what I teach others to do. But, it's a little bit hard to remember if you don't keep track of it. So after the run is over, if something was bothering you a little bit, or you felt some soreness somewhere, I just note it, left calf soreness, or ankle felt a little off. And sometimes, it goes away and it's fine, but sometimes it persists, and it's good to look back on those things. So keeping a
Oh,
training journal is important.
I can tell you from a sports medicine physician point of view, that is great, because you have all the data right there. I could just look at the notebook and, do further evaluations based on the pain and that patient has felt or an athlete has felt.
Oh, well, that's good. All right. That's good to hear. Yes. So tell us where we can find you.
Yes. So I am on Instagram at MedFitDO. That's M as in Mary, ED as in dog, FITDO. And I'm also at the same handle on YouTube. All right. So Running coach Michelle is in the hot seat. All righty. So, my question for you is, if someone is interested in a running program, how should they start and then progress in terms of
Oh,
mileage?
yeah, I think this is a great question. It depends on where you're starting from. It depends. So usually, step one is to figure out where you are in terms of your current fitness. Like, are you coming from the couch? Are you a walker? Are you a runner? Are you a runner, but you haven't run in a long time? So there's a lot of questions at the beginning just to kind of figure out where we're starting from. But the general advice is always to start low and go slow. That's usually what I tell everyone, especially if you are new to it or you've taken a long time off. And I think, one of the biggest mistakes newer runners make is that they try to do too much too quickly. Like, there's a lot of motivation there, which is wonderful, but you also don't want to go out too far and too fast and potentially get injured or burn out in the sport just as you're getting started. So the general advice is to take it very easy and set very manageable goals for yourself in terms of where you are with your current fitness. But a coach can definitely help you figure out where you're at.
Yes, I love what you stated to start low and go slow, because as we've spoken before, if you overtrain, especially at a rapid pace, then you can be susceptible to injuries, running injuries. So that's especially important if you want to prevent those injuries. You want to be very gradual in your running program. So that's awesome. I love that.
Yes.
All righty. So, I love the name of your whole brand, Mindful Marathon. And my question to you is, how can runners incorporate mindfulness when they're running?
Ooh, okay. I love this question. So when I started running, I certainly didn't view it as an exercise in mindfulness. And I think that I discovered that by accident. When I started, I was going through a very rough time in my life. There was a lot of just upheaval, new job, just done with my residency and studying for board exams. And my dad was sick at the time. He was diagnosed with lung cancer, just a lot going on. And this is when I decided to really pick up the sport and get back into it. And I noticed that when I would go out for even 5 or 10 minutes on my jog around the block, that my mind would kind of clear, like all of those thoughts and all of the other stuff would go away. And I think this is why I stuck with it at the time. I didn't realize, but looking back, I think that's why I kept going out there every couple of days and doing my 5 or 10 minutes. So the first step for anyone trying to bring a little bit of mindfulness to their running, I would say get rid of your headphones. If you run inside or outside, I would say try to ditch the headphones and just take 10 or 15 minutes without them. If you feel very attached to your headphones, I know a lot of my runners are very attached to listening to music or a podcast, or they have to have something on in the background. And this can be a very hard exercise for them, but I say approach it with a little bit of curiosity and try it for 10 or 15 minutes without anything on, and just start to pay attention to your breathing and how your pace feels in your body, and to nature, and maybe some, I say, the flora and fauna around you. Just trying to be a little bit more in tune with yourself and with nature. And I think, an easy way to do that is just to try to get rid of the background noise and take the focus in a little bit. So I think get rid of the headphones is step one.
Nice. I love that. And so I have a story to tell that's very similar to what you stated. So when I ran the Staten Island half marathon, I left my headphones in the car. And I
Uh-huh.
typically always run with headphones. And so I got to the start line. I'm like, oh my gosh, I can't go back now. I mean, I'm here. And running the half marathon without my headphones was actually just such a beautiful experience, because while running, I was able to hear the crowd. I was, able to hear all the motivational chants that people were, shouting out to us as we were running. I was able to hear everyone so excited as I crossed the finish line.
Oh
So
yeah.
I know exactly, how that is firsthand. So that's awesome. I love that tip.
Yeah, yeah. And for races, if for people who are nervous about not having their music, I tell people to, have them with you, but maybe don't turn them on or don't put them in until maybe you really feel like you need to have the music, but start out without anything and see how it goes. But you're right, you pay much more attention to, yeah, the spectators and the volunteers and all the cheering, and it's a great experience.
It is awesome. Now, this kind of ties hand in hand with the previous question, but what makes your running program unique than all the other running programs out there?
Yeah, I think probably the best part about it is just the customized training and personal training. So we really dive into your motivation to run and your why. And we work from wherever you are. So you don't have to have any certain experience level. You can be a newer runner. The best thing about the training program is that people start out thinking that they aren't runners or that they can't be runners. But after working together for some weeks or months, my athletes come back and say things like, well, I just ran 3 miles today. And I became a person who says, I just ran 3 miles today. And so we have people who don't think that they are runners or can be runners and are runners now, and they're in the sport for the long haul. So I think that's the best part of the program.
Oh man, I love that. I love that. I love that. Awesome. All right. So, tell our listeners where we can find you.
Oh yeah, I think the best place is probably on my website. It's www.mindful-marathon.com or over on Instagram at mindful.marathon. And if you are a newer runner or a runner who hasn't run in a while, I would love to help you get started in the sport or get back to training in the sport. And you can schedule a free coaching call with me at the link below.
You want to learn more about sports medicine injuries and how you can use exercise as medicine, subscribe to my YouTube channel. And on my Instagram, I have fun, simple, and practical exercise videos that you can simply do with your friends and your family.
I love it.
Well, awesome. Thank you so much, running coach Michelle. All right. I'm pretty sure our
Thank
listeners
you.
receive so much running tips and advice, and hope you guys found this helpful.
All right. Thank you.
All right. Bye.
Bye.